Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And today we're going to talk about a study on knee pain in 56-year-old, the average age was 56, which is not too far off from where I'm at. And going to talk about what are some better options, because the study compared 156 people. They were either given the option for physical therapy, for PT, or cortisone injections, and they looked at the cost benefit of these interventions over the course of a year. And in the physical therapy group, it was 4 to 6 weeks of PT, up to 8 sessions, and the other one was in the cortisone injections. Everybody had 1 injection, up to 4 at the doctor's discretion. The average number was 2.6 injections, so most people got more than 1 injection. And they compared them over the year, and the costs were about the same. However, the outcomes, what they call QALYs, or quality associated life years, were better in the PT group. And I'm going to suggest there are ways to make this even better, because I'm generalizing here, but a lot of PTs will just do strengthening exercises, maybe some interferential, simple stuff that you can do at home. However, there are PTs that are very well versed in soft tissue treatments. Not a terribly big fan of dry needling. I don't think it's there yet. I think there's a lot of maturing that needs to go on in that field. But soft tissue, whether we're talking about Graston, we're talking about fascial manipulation, ART, those different things. There's a lot of PTs and chiropractors and quite frankly, athletic trainers and massage therapists that can live in that realm and do a damn good job with knee problems. So, one of the things we need to look at is the problem is that steroids are not without potential damage, long-term damage, and yet it's the default. Somebody goes to their doctor, they have some knee pain, there's a good chance they're going to get a cortisone injection. And yet there is every indication that cortisone injection may actually cause more rapid breakdown of the knee, the very problem somebody's there. It may accelerate, and the evidence is really quite strong on that. Same thing with anti-inflammatories. I generally think that anti-inflammatories are one of the worst things we can take for arthritis long term, not to mention the fact that your liver, kidneys, and heart, possibly brain, are not going to be happy with you either. So what are some options? What do I think are the 7 most powerful tools in order of how to manage them? First one is movement, exercise. The biggest thing people do when their knee starts to hurt is stop moving. And that's the worst direction of what we can do. We need to move. The other one is, I already mentioned it, it'd be considered soft tissue manipulation, or it's very advanced soft tissue work, looking at the fascia and everything surrounding the joint. As a chiropractor who treats a lot of knee pain, I would much rather have the ability to do soft tissue than I would adjusting the knee. Could care less about things like interferential and ultrasound. I would much rather be able to loosen up the tissues around the knee. I've had patients ready for knee replacement that literally 2 or 3 visits later, they're already canceling their knee replacement surgery because their knee is feeling drastically better. And we didn't fix the arthritis, but that wasn't what was causing the pain. So number 3 is exercise or movement. You're like, hey, you said that already. Yeah, because that's how important it is to help with the knee. So movement, in case I didn't say it before or not going to say it later. Weight loss. The BMI was pretty high in this particular group. 31, I believe, was the average. But weight loss, not only from a weight stress on the knee standpoint, but also inflammation that's driven by largely gut extra weight. Drives inflammation, creates some problems. Now, that's not an easy answer, but it is definitely can't go without saying, because it's an important factor in knee pain. I also happen to be a big fan of PRP, platelet-rich plasma. I don't think there's a downside to that like there is with steroid injections. And you're really looking at helping to heal the joint. But PRP can't be done by itself. It needs to be part of a package of working on the soft tissues around the knee. As far as exercise, it can't be used as a standalone therapy. In that same vein are the gel injections, hyaluronic acid, Rooster Comb, Synvisc. They've come a long way in the past 20, I believe 98 might be when they were first approved. I don't see a downside to them. They don't seem to work as well as I really would have liked them to, but it's definitely a part of a knee arthritis package of things that you should do. And tail end, seventh is stem cells. Now, big fan of them, but they're not versus PRP when it comes to the money. I think that platelet-rich plasma is generally a fraction of the cost and can sometimes get just as good of benefits, but stem cells on the list. If you win the lotto, by all means, stem cells are a great option for arthritic knee pain, so no issues with them other than the costs with them. And as always, I'll post the link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.